Good afternoon, this is Dr. Valdez from Hair Loss Solutions, and today's topic will be hair transplantation. The reason I'm covering this is I have a lot of patients that come into the clinic asking about hair transplantation, and they want to know, what does it consist of? What do you do when you do a hair transplant? To better understand how hair transplant works, I tell patients that first you have to understand how people lose their hair. If we look at the majority of the people that have hair loss, whether it's mild thinning or whether it's balding, we'll notice that a lot of the thinning or balding will start to occur towards the top of the head and towards the top of the back of the head. Even people that have lost most of their hair will always see that they maintain a rim of hair towards each of the sides and towards the back. What this tells us as we see patients is that there's certain areas on your scalp that the hairs are very resistant to being lost. And there's other areas that are usually very common in hair loss where people lose their hair. What we do as hair transplantation surgeons is that we take hairs from the very resistant areas towards the back and sides of the head, and we individualize those hairs that we take out, and we move them and transplant them into areas where the patient is thinning. We normally have to do several thousand of these transplantations. We'll take out a strip of hairs, we'll cut them individually, and we'll put them back into the scalp. When those new hairs now start to grow, they contain and maintain the same characteristics as they had when they were towards the back or sides of the head. These are very resistant to being lost over time. So what happens is when you do hair transplantation and you move the hairs to the areas where you're thinning, those areas you will maintain for the rest of your life. You will never thin again and lose those hairs that you transplanted. So this is definitely a permanent solution to hair loss. Now, one of the caveats to hair loss that I tell my patients is that we're basically transplanting into areas that you were thinning. But you have to remember that you still have some hairs where we transplanted you from before that you haven't lost yet. But those hairs are still apt to be lost over time if you don't do anything to maintain it. So with hair transplantation, we make that area thicker, fuller, look more lush, and give you a more natural, younger look. However, what we want to do after surgery is not only maintain those hairs that we just transplanted, but maintain the hairs that were already there. So this is where medical treatment comes in. So even after hair transplantation, one of the most important things afterwards to maintain your existing hair is to be put on some form of medical treatment. What we choose will be patient dependent, and depending on the patient's situation, why they have their hair loss, we'll recommend different treatments. I hope this answers some of your questions about hair transplantation and what we do. If you have any further questions, feel free to see us here at the office at Hair Loss Solutions. We offer a free consultation, and we can give you a hair check and hair analysis and give you an individualized program. Our number is 954-613-5777, or visit us on our website at www.haircosmeticsurgery.com. Thank you.